Good morning, good afternoon, everyone. A warm welcome to session 3 of the ICD-11 web training series for Caribbean countries. It is inspiring to see so many dedicated colleagues from across the Caribbean joining us again to master ICD-11. The topic today is the ICD-11 tooling environment with a special emphasis on ICD-11 Browser. ICD-11 represents a modern evidence-based framework designed to capture more nuanced clinical concepts, support better patient care, improve public health surveillance, and enable richer data for research and policy decisions. It reflects advances in medicine, digital health, and international collaboration, while remaining rooted in the familiar structure of ICD that you have relied on for years. Over the course of this session and the series to come, we will dive deeper into other features, resources, and tools of ICD-11. As you already know, ICD-11 Mortality Coding Web Training Series is a foundational introductory resource to help you become familiar with ICD-11 concepts and terminology. It is not a substitute for a comprehensive formal ICD-11 training program. For full proficiency and certification, please pursue an in-depth, in-person or formally structured course delivered by recognized ICD-11 training providers. Thank you for joining this important journey. Together we will unlock the power of ICD-11 to improve mortality reporting, support better patient outcomes, and strengthen health data worldwide. Let's begin with a high-level tour of what's new, what stays familiar, and how this transition will unfold in your daily coding practice. My name is Saman Gamage, and I'm a medical doctor with a specialization in public health. I currently serve as a senior technical advisor on medical certification and ICD within the Bloomberg Data for Health initiative of the CDC Foundation. This is the expected outcome of today's session. By the end of the session, students will be able to use the ICD-11 browser to view and navigate the content. Here is my lesson plan. I will first talk about tools available with ICD-11, ICD-11 browser, and ICD-11 features, browser features in detail. And then I will also talk about other available tools. Our ICD-11 training series will focus on the tools that end users interact with directly. These include browser, the primary way to explore and access ICD-11 content, search for diagnosis and review coding guidance, coding tool, a practical desk-side companion that helps you apply ICD-11 codes accurately in daily workflows, ICD Fit, a user-friendly resource to check alignment, fit, and applicability of codes to specific clinical scenarios, ICD e-learning tool, an engaging self-paced learning platform to build proficiency and confidence with ICD-11 concepts and coding. While there are additional tools designed for development, maintenance, and for programmatic access, our series will concentrate on the end-user experience. We will cover how to effectively use the browser and the coding tool to streamline your coding work, improve accuracy, and enhance your understanding of ICD-11. The ICD-11 homepage presents a clean, modern dashboard that serves as the entry point to the full taxonomy, search, and tooling ecosystem for ICD-11. At a glance, you will notice the primary navigation tools. For fast concept lookup, enabling quick discovery of tools and resources. On the left, the navigation panel provides quick access to core sections, including the ICD-11 browser, the coding tool, the ICD API, and the ICD-11 Implementation and Transition Guide. This layout supports seamless exploration without leaving the home view. Under the Learn More tab, you will find resources such as the ICD homepage, the ICD-11 reference guide, a fact sheet, licensing information, then online training package, and a short introductory video about ICD-11. There is also a convenient link to the ICD-10 browser for reference. The Be Involved tab provides access to the ICD-11 maintenance platform, which we'll discuss in more detail later. The fourth tab connects you to other classifications, including International Classification of Functioning, Disability and Health, ICF, illustrating how ICD-11 interplays with related standards. Together, these elements create a comprehensive starting point for learning, exploring, and implementing ICD-11 with quick access to guidance, updates, and related resources. ICD-11 tooling infrastructure. In the ICD-11 tooling infrastructure, there are implementation tools that support adoption and day-to-day use of ICD-11 in coding, reporting, and data management. Software integration tools to enable ICD-11 to work smoothly within existing health information systems through APIs, mapping, and interoperability features. There are training and capacity building tools to build knowledge and practical skills across the workforce with modules, exercises, and assessments. Maintenance tools ensuring ongoing accuracy, updates, monitoring, and support after deployment. For implementation, there are ICD-11 core tools, ICD-11 coding tool, a multilingual tool currently available in 15 languages, ICD-11 Browser, again multilingual and currently available in 15 languages. Then there are mapping tables for mapping ICD-10 codes to ICD-11 and vice versa. For implementation, there are other tools for morbidity and mortality. For morbidity, you have WHO morbidity reporting form, then automated coding, batch processing of coded term sets with ICD-11 index, then ICD-11 and ICHI, International Classification of Health Interventions based International Diagnosis Related Group System, DRG system, then functioning assessment with WHO 2.0, WHO Disability Assessment Schedule. Mortality is our primary focus. For implementation, among the mortality tools, there is WHO cause of death form, the standard death certificate format in digital and paper format. Then guidance for medical examination of the dead body and certification. Doris rule engine for automated selection of underlying cause of death. Special tabulation lists for mortality. And then ANACOD 3 and code edit for quality. And for out-of-hospital deaths, WHO verbal autopsy questionnaire. Talking more about implementation tools, implementation guidance and monitoring, there is Implementation and Transition Guide from WHO, and then WHO FIC Implementation Tracker. For software integration, ICD-11 APIs with language-specific layer guidance to integrate new release versions of ICD APIs. Embedded classification tool makes it possible to integrate complete ICD-11 coding tool or ICD-11 browser into any web application. The embedded classification tool is written in JavaScript for the complete compatibility with any web application. For training and capacity building, ICD Fit platform is available. ICD Fit stands for ICD Field Implementation Tool, which has an interface for line coding, interface for main condition coding, interface for patient safety coding, interface for course update coding, which is under development, and interface for coding interventions. Then there is an ICD-11 e-learning course accessible through the WHO homepage, and WHO Academy ICD-11 course includes curriculum, storyboarding, and visual design. There are also training materials prepared by OFIC collaborating centers and early adopter countries. For maintenance, there is a proposal platform to submit proposals, which is open for anyone who would like to submit a proposal for improvement. And there is a translation platform as well. Okay, focusing on ICD-11 tooling environment. So we will focus more about ICD-11 Browser and ICD-11 coding tool, and later on we will talk about ICD-11 maintenance platform and ICD API application programming interface. During this presentation, we will focus more about ICD-11 Browser. ICD-11 Browser is an online searchable interface for exploring the 11th revision of ICD. It is designed to help users find definitions, code ranges, and structure of diseases and related health conditions. So this is how you will access ICD-11 Browser. There is a link from the home page, and ICD-11 Browser is available for seeing the content. Remember, this is not for coding, and this is for seeing the content. So once you have opened the browser would look like this. There is a search window, and this is an enlarged version. So once you have entered the text diagnosis or search terms, the browser tool allows coder to search courses using text-based terms and identify all possible course categories available. Let's discuss about the features of ICD-11 Browser. With ICD-11, you get a user guide which is accessible through the home page, and I will show you how to do that. And you can use browser for browsing, searching, post coordination support, to display search value sets, and most importantly, this is multilingual and currently available in 15 languages. In the browser, there is an info tab. If you open the info tab, you can access the user guide, and we will talk more about user guide in a moment. Then you can also access print versions of ICD-11. Print versions are available. You can access ICD-11 reference guide, a direct access link. Then there is a spreadsheet file, a link to ICD-10 to ICD-11 mapping tables, 10 to 11 and 11 to 10 mapping tables. Then a link to ICD-11 maintenance platform to contribute and submit proposals. A link to ICD-11 homepage. Then if you want to know about the releases and updates history, there is access. Then mortality tabulation list and morbidity tabulation lists for ICD-11. And then WHO list of vaccinable conditions. And you can also access WHO FIC Foundation. And you can see the evolution of Foundation, and you can see and you can visualize and you can open the Foundation. From the browser, there is a direct link to ICD-11 coding tool. So while using the browser, if you want to open the coding tool, can be accessed from the browser. Let's talk more about user guide. So this is how you access user guide. So this means if you want to learn more about a browser, and there is an inbuilt user guide you can easily access, and you can learn more about the use of browser. The user guide is available through the info tab, and you can select this and user guide will open, which provides a considerable explanation about using browser. The ICD-11 browser is the online application used to browse the ICD-11 mortality and morbidity statistics tabular list. There are three options for searching the ICD-11 browser. Through a quick search that allows the user to navigate quickly. A quick search looks for code titles and begins searching as you type. An advanced search allows the user to search selected properties or a selected subset only. A third option is browsing via hierarchy, that is tabular browsing. This is useful when trying to locate an entity within the hierarchy. However, browsing via the hierarchy is not encouraged. Quick search. Through a quick search that allows the user to navigate quickly. A quick search looks for code titles and begins searching as you type. This is how you will use quick search. If you want to search neoplasms, you can just type neoplasms, type in neoplasms in the search window, and quick search will help you to see what is there in chapter 2, neoplasms. And if you look for cholecystitis, all entries with cholecystitis will appear, and you can browse and read and see whatever you want to search, whatever we want to see. And this is a quick search in candidiasis. So many entries with candidiasis, all the entries with candidiasis will appear, and you can see the content, how candidiasis is classified and how it is indexed. Advanced search is another method of searching, and if you want to open advanced search, there is a button here, the orange text, and you can click here and advanced search will open. Advanced search lets you search selected properties of the classification. Provide keywords in the search text field and check the properties. So what are the properties in advanced search? So we are searching for tuberculosis. You can search by index term. If you wish, you can search by title. You can also search by fully specified name. If you want to read the descriptions, you can search by description. If you want to know about the exclusions, and then if you want to read coding notes, so all these properties are available. So as you wish, you can select one or more of these advanced search criteria for your search. So as I told you before, advanced search lets you search selected properties of the classification. I'll show you some examples. It provides keywords in the search text field and check the properties. Here you can see tuberculosis is searched as index term, and tuberculosis unspecified, other specified tuberculosis, and all these entries appear here. Advanced search by index term. This is an example of advanced search by fully specified name. Tuberculosis attributable to Mycobacterium tuberculosis, the fully specified name of the disease condition. Tuberculous meningitis, bacterial meningitis due to Mycobacterium tuberculosis. So that's a fully specified name. If you want to read the descriptions, so descriptions are available here. Tuberculosis, a disease caused by an infection with bacteria of the Mycobacterium tuberculosis complex. This disease presents with symptoms depending on the site of infection. transmission is commonly by inhalation of infected respiratory secretions. So if the coder or the users was to read about description, so whatever the diagnosis you have entered, you can go through the descriptions through this advanced search. The other method of searching is browsing via hierarchy. Instructions are available in the user guide. After this session, you can access your open your browser and access user guide and learn more about how to use browser in quick search, advanced search, and browsing via hierarchy. So when you browse via hierarchy, you see the classification hierarchy on the left side of the screen. Clicking on any item will display the details of that entity. Initially, the system only shows the top level items. However, you may make the children visible by clicking on the small triangles on the left side of the items. You remember last time we talked about parents and children and siblings. So initially you will see the top level items, but you can make the children visible by clicking on the small triangles on the left side of the items. Here is an example. So I click on this triangle, ICD-11 for mortality and morbidity statistics. All chapters are open. And then you can search for neoplasms, neoplasms of central nervous system, primary neoplasms of brain, gliomas of brain. So you can keep on searching or browsing via hierarchy. I told you that the browser is multilingual. So because of this multilingual feature, you can use browser using 2 languages simultaneously. By clicking on the language option icon on the right upper corner, you can open the available languages and you can select the appropriate languages. Now in this selection, I have chosen English and French. English here and French here. So on the screen, to your left, you can see the English entries of browser for the same condition, meningiomas unspecified, and to your right, you can see the French version of 2A01.0Z, meningiomas unspecified in French language. So this is a wonderful feature. You can check the comparability of entries in multiple languages. Then if you want to resize the hierarchy horizontally, you can use this tab to resize, and you can do it here and here. You can resize the window. Okay, so ICD-11 browser. Now here I search for cholelithiasis unspecified. Cholelithiasis means presence of gallstones in the biliary system. And you can see the code. But this is, remember, this is not for coding. This is for viewing the content. If you want to code, you have to use the coding tool, which will be our topic for the next month's presentation. Next month's webinar, ICD-11 coding tool, and today we discussed about ICD-11 browser. So you can check and visualize or see the available codes. So cholelithiasis is unspecified, the code is DZ11.Z, but you cannot assign the code using the browser. You can only see. And you can also check the post-coordination options. If there are manifestations of cholelithiasis, you can assign additional codes, but you can view the available additional codes for manifestation through the browser. And if you want to know about the cause of the disease and then the possibilities of coding the cause of the disease, you can check what is available here. So these are post-coordination options. And for manifestations, all browser values you can check here. Okay, let's move on to other available tools. We have ICD Fit, ICD Field Implementation Tool, and then there is Doris for automated mortality coding. Then there is an ICD-11 MCCD app in DHIS2, an ICD API application programming interface. ICD Fit is a tool available for training and capacity building. ICD-11 coding training and self-evaluation tool, ICD field implementation tool. ICD user can test their accuracy in coding with ICD-11 using ICD Fit. WHO and member states can check translation and data quality using this tool. So this is the purpose. It has the features. It provides immediate user feedback on their coding performance. You can create an account, you can send your request, and you can join any center, any coding center, and then you can do the exercises for morbidity and mortality, and then you can check your performance by yourself. And there will be a coordinator who will help you and who will take you in, and yeah, so you can see your ranking with peers. It's a very interactive tool, and during in-person training courses as well as during online training courses, the participants, the coder trainees, or the other participants enjoy using the ICD Fit platform, field implementation tool, which provides you a feedback, an immediate feedback. So we have observed good to very good ICD-11 coding results with training. Doris stands for Digital Open Rule Integrated Course Update Selection. It is a multilingual software designed for automated underlying course update selection. Doris was created to convert ICD mortality coding rules from textual into digital format. It has been done. Assist in automatically selecting the underlying course update following the mortality rules. It employs an advanced algorithm to process and interpret the information. So this tool can automatically assign ICD-11 codes and then select the underlying course update code. This is Doris home page. There is a web version. So web version can be used when you have an internet connection, and then you can code death certificates one by one. Then there is a desktop version as well, which can be downloaded into a computer, and this can be used for batch processing of large numbers of death certificates. So within a very short time, it is able to code, batch process a set of large numbers of death certificates, hundreds of death certificates, or thousands of death certificates, and give you the underlying cause of death selection, and codes the individual conditions as well as select the underlying cause of death, applying WHO mortality coding rules. So we will talk more about Doris application in a future session. Then another tool available with ICD-11 is ICD-11 MCCD app in DHIS2. For the countries using DHIS2, this app will be useful. So it is an ICD-11 based medical certificate of cause of death form, and which is linked to integrated to Anacod 3, and therefore you can do data analysis through integrated Anacod 3. Data visualization and reporting is possible, and then there are customizable forms, workflows, user roles, etc. ICD API is ICD-11 application programming interface for easy integration of ICD-11 in any software. ICD API web services allows other software to access the ICD content. It is an HTTP-based REST API, is a type of web service that allows programs to communicate over internet using HTTP protocol following REST architectural style. HTTP stands for Hypertext Transfer Protocol. It is the foundational protocol used by the World Wide Web, WWW, for transferring data between a client and a server. A REST API is a type of web API that follows the REST architectural style. REST stands for Representational State Transfer. It defines how clients can interact with resources over HTTP in a standardized, scalable way. Easy to consume, technology independent, and can be consumed from any programming language or platform. ICD API currently supports 15 languages. ICD URIs and API endpoints. Hope you remember we talked about URIs in our first and second presentations. The cloud-hosted version of the ICD API is available at this web link, and all the endpoints of the API are under this URL. ICD-11 uses URI as unique identifiers for individual classification entities in the foundation component. As I explained to you before in the previous presentation, there are much more entities found in the foundation component of ICD-11 than what you see in the ICD-11 morbidity and mortality statistics. And they all have a unique resource identifier and definite location in the ICD foundation. So these URIs are actually the endpoints of cloud-hosted API. For example, URI for cholera in the foundation component is this. For each and every entity in the foundation, there is a specific URI. Let's talk about ICD-11 digital infrastructure. Imagine an ICD-11 toolkit designed to be openly shared and relentlessly useful across the global health landscape. It is freely available with no licensing constraints and no fees to hinder access or adoption, inviting every health professional, researcher, and developer to explore and build upon it. Its design emphasizes ease of use and seamless integration. The toolkit is crafted to plug into existing software ecosystems with minimal friction, so it can be deployed in a wide array of settings, from busy hospital information systems to specialized research platforms, without requiring extra tooling or complex workarounds. This makes it a practical core that developers can lean on regardless of the technology stack in use. It is multilingual by design. The ICD-11 toolkit speaks the world's languages. It supports diverse users and patient populations, ensuring that language barriers don't stand in the way of accurate coding, meaningful analytics, or clear communication across borders. Looking ahead, the tool is future-proof to enable semantic interoperability. It is built to align with evolving data standards and interoperable data models, so information remains meaningful when shared between systems, regions, or initiatives. In other words, it's prepared to grow with the needs of global health information exchange, not outpace them. Clinically up-to-date is the standard. The toolkit is maintained through an open, public, and transparent process, so clinicians and developers alike can see what's new, what's changed, and why. This ongoing stewardship ensures that revisions reflect current evidence and practice while preserving trust through visibility and accountability. Governance is grounded in authority and collaboration. It is controlled by member states for member states, aligning with a democratic, locally led approach to stewardship. This arrangement follows the spirit of the World Health Organization's call for nominations of official ICD focal points by member states, ensuring that leadership and oversight come from those who most directly use and are impacted by the system. In sum, this ICD-11 toolkit is an accessible, integrable, multilingual, forward-looking, openly maintained, and state-governed solution. It is designed to empower diverse users to code, analyze, and share health information with clarity, consistency, and confidence today and for the future. So this brings us to the end of our presentation for today. However, as usual, we will go through some exercises based on what we discussed just now. So these exercises are based on ICD-11 tools and browser. And you can try these exercises and you can send your answers in the chat if you like. I will first display the exercise and then I will show you the correct answers. What ICD-11 tools are available to end users? Select the appropriate ones. ICD-11 Browser, ICD-11 Coding Tool, ICD Field Implementation Tool, ICD Fit, ICD e-learning tool, all of the above. So what ICD-11 tools are available to end users? Thank you very much for your responses. Yes, Maria, you are correct. The correct answer is all of the above. So all these tools are available to end users. Thank you very much, everyone. Let's move on to exercise number 2. Which of the following methods describe the different methods of using the ICD-11 browser? Identify all correct answers. A. Quick search. B. Advanced search. C. Browsing via hierarchy. D. Post coordination. E. Search in alphabetic index. So you would select all correct answers, all correct. So which of the following methods describe the different ways or different methods of using the ICD-11 browser? Okay, very good. I can see correct answers. Thank you, Benjamin. Quick search, advanced search, many correct answers, and browsing via hierarchy. So these are the different methods of using the browser. You can search post coordination options, but it is not a method of using the browser. The three main methods are quick search, advanced search, and browsing via hierarchy. Exercise number 3. What tools are available for mortality use cases? WHO MCCD form, digital and paper-based. Guide for medical examination of the dead body and certification. So this is a open-ended question. So you would provide the correct answers. So what else are available? MCCD form, guide for medical examination of the dead body and certification. What are the other tools available for mortality? Doris, which is for automated mortality coding. Then we have a special tabulation list for mortality tabulation. Then Anacod tree and code edit are also useful tools for mortality use cases. And there is WHO Webel autopsy questionnaire for out of hospital deaths. So they are all all of these tools are available for mortality use cases. Okay, exercise number 4. Please state whether the following statements about ICD-11 are true or false. A. ICD-11 browser is useful for seeing the content of ICD-11. I will first go through the responses and then you can let me know which statement is true and which one is false. During a quick search, one can navigate search results by code title. C. Browsing via hierarchy is the preferred and encouraged method for browsing ICD-11. D. Advanced search lets you search for selected properties of the classification. E. The ICD-11 browser is multilingual. What do you think about A? ICD-11 browser is useful for seeing the content of ICD-11. Is it true or false? It is true. Yeah, very good. During a quick search, one can navigate search results by code title. Yeah, which is again true. Browsing via hierarchy is the preferred and encouraged method for browsing ICD-11. We cannot say it is the preferred method. It is a method, but that depends on why you use browser. So if you want to quickly search something, browsing via hierarchy is not the option. And if you want to search for different characteristics of something, then browsing via hierarchy is not the option. Then you will go for an advanced search. So it is not the preferred. So I would say it is false. And then advanced search lets you search for selected properties of the classification. It is correct, true, very good. And last response, ICD-11 browser is multilingual. Yeah, it is true. It is available in 15 languages. Very good. Thank you very much for your responses. Then exercise number 5. Please state whether the following statements about ICD-11 tools are true or false. Doris is designed for automated underlying cause of death selection. B. ICD-11 application programming interface is helpful for easy integration of ICD-11 in any software. C. The use of ICD-11 tools requires licensing. D. ICD-FIT is an ICD-11 coding training and self-evaluation tool. E. Mapping tables are available from WHO to map ICD-10 codes to ICD-11 and vice versa. So what do you think of these statements? A. Doris is designed for automated underlying cause of death selection. Yes, it is true. Thank you. B. ICD-11 application programming interface is helpful for easy integration of ICD-11 in any software. Correct. True. C. The use of ICD-11 tools requires licensing. No, this is false. You don't require any licensing. They are freely accessible. ICD-FIT is an ICD-11 coding training and self-evaluation tool. Yes, true. Very good. And then E, mapping tables are available from WHO to map ICD-10 codes to ICD-11 and vice versa, which is again correct, true. And thank you very much for your interactive answers, and then most of them are correct. Thank you. So this brings us to the end of this session. So we will continue some more sessions in upcoming months, and this will be notified by PAHO. So before we wrap up. If you have any questions, you can ask your questions. I can see Sandra has raised her hand. Yeah, please. Yeah, Sandra Cotton asks, can we please receive a copy of the presentation? I think you will receive a video. This is being recorded and the video will be circulated among the attendees. So you will receive the video recording. Any more questions? Okay, if there are no more questions, we will wrap up now. Thank you very much for your active participation, and I really enjoyed your responses to questions. Thank you very much. See you next time.